Assalamualaikum warahmatullahi wabarakatuh. Distinguished Chairperson, Honorable Committee members, and respected participants, good day, and it's a great honor for us to present our research entitled Optimization of Construction Project Implementation Time Using Critical Path Method, Case Study of National Brain Center Hospital Construction Project. This paper is authored by I.R. Risma Fitriani, STMT, Aira Nazwa Artamevia, Ade Momon STMT, Dr. I.R. Sukanta STMT, and Rianita Puspitasari STMT from Universitas Singapura Bangsa Karawang, consisting of lectures and students. This research is presented for the proceeding of the 7th Borobudur International Symposium 2025 in conjunction with the 3rd Interconnects 2025. To begin, allow us to briefly explain the background and purpose of this study. Next. Okay, this study applies the critical path method or CPM to analyze and optimize delays in the construction schedule of the National Brain Center Hospital project in Jakarta. Using field data and CPM-based modeling, this research identified the root causes of project delays, determines a critical project duration of 500 days, and demonstrate that the CPM approach significantly improves scheduling accuracy, project control, and the quality of managerial decision making. The problem that we talk in this research show in the slides the project delays, time control, and activity inefficiency. Following this overview, we will now present the background of the problem that motivate this research. Next. Delays in the construction project frequently result in cost overruns, decreased work quality, and disruption in service delivery. These challenges are commonly caused by weak scheduling practice, poor communication, unfavorable weather conditions, and limited resource availability. Therefore, this research aims to identify critical activities, analyze delay factor, and improve time management through the application of the critical path method. In addition, this study uniquely evaluates non-critical activities that have large flow values to prevent inefficiencies and to optimize resource utilization. And after outlining the background, we will now explain the research methodology using this study. Next. This study employed the critical path method to systematically analyze construction activity in the National Brain Center Hospital project. The project activity were structured into a work breakdown structure and processed using KM for Windows to identify the critical path. This process enabled the identification of the critical path, calculation of the slack time, and generation of the Gantt chart. For example, the CPM diagram is in their slide. Through this method, the study achieved more accurate schedule optimization and improved project time control. Next, we will present the research finding and key analysis results. The project activity data were organized based on activity codes, duration, and predecessor relationship. These data were then visualized in the form of a work breakdown structure. This table shows the work breakdown structure that we have created, and The aim for this work breakdown structure to support an identification of the critical and non-critical activity. So having the examined the overall project structure, we will now focus on the identification of the critical path. Next. This is the critical path diagram of a national brain center hospital project. Next. So, based on the CPM calculation under normal time condition, the critical activities were identified along the following sequence A, B, C, D, E, F, G, H, I, A, AC, AD, AF, AG, HA, AH, AI, AG, and AK. Next. So this sound is the analysis of the critical path method. Next. The red line is the critical path of the project. Next. Next. Okay, the critical path was determined through forward pass and backward pass calculation, as well as by measuring the total slack of each activity. This result provides a clear foundation for effective project time control and scheduling decision. Next, finally, we will present the main conclusion of this study. This study concludes that the application of the critical path method is highly effective in improving the accuracy of construction project scheduling, strengthening time control, and supporting faster and more reliable managerial decision making. Furthermore, CPM help minimize project delays without requiring significant additional costs, thereby ensuring more activity, more activity efficient and timely project completion. Next, and thank you for your attention and kind consideration. We certainly appreciate the opportunity to present our research and this at this respected forum. Thank you.